11, Unit 9, Respiratory, Unit 9, Cardiology, Unit 10, Respiratory, and Unit 11, Tropical Diseases. And then we will have the last session is for revision. Okay, let's begin. Unit 9, Cardiology.
Hình như cô không mở mic đó cô à.
Thank you. Yeah, thank you. Sorry. Yeah, we studied Unit 9 in 2 sessions. Session 1, we studied vocabulary, listening 1. It's only listening 1. Yeah, and grammar about the future. So first of all, I think we should have a look at listening, a heart condition.
Bị tắt tiếng rồi cô ơi.
Yeah. So here, we should learn some words that we will find in the conversation, that like actual. For you to emphasize that something is X, and you say actually, stable, several, spray, pop is an act of breathing in something. You say breath, just like in breath, like breath and breathless. Agitate and agitated. To make somebody feel anxious, it's an agitated. To vomit, to injure, and the noun is injury. Major, bleed, it means to lose blood. Consent, this is an agreement to do something. Procedure, I think when we talk about procedures, we talk about some kind of surgical procedure. Effect, to get rid of. Blood clots, and risk of disease. So these are some kind of words that you will find in the conversation. Okay. So, oh my. In listening 1, we are going to listen to Mr. Lawson's wife. She's talking to the doctor in A&E. You Okay. Yeah. So I think you have the book, correct? Sorry. So we considered in our book, we listen and describe the doctor's manner and the mood of the patient's wife. And then we have to write notes on what it says about the GTN spray, the time when the pain started, thrombolysis, and prognosis. Okay, so just listen, huh? Oh, sorry. I think I should do something because there's something wrong with this. Sorry. Yeah. So we see, we listen, and you have to write down some things about the GTN spray, the time when the pain started, the thrombolysis, and the prognosis. And I think you also need to write about the doctor's manner and the mood of the patient's wife.
Unit 9, Listening 1.
He's not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
That's a relief.
I just need to ask you a few quick questions. Can you tell me what happened?
We were sitting at home and he started getting this pain in the center of his chest. He'd had it several times before and he used the spray thing he's got.
The GTN spray.
Yeah, that's it. And so he gave himself a few puffs, but the pain wouldn't go. And I could see that he was getting breathless and agitated, and he said he felt sick. He started vomiting a little, and he was beginning to sweat. And he said he thought he was going to die.
Okay. So can you tell me what time that was?
Well, I called for an ambulance at 7-ish, and it came like a shot. So it was less than an hour ago in total.
So has he had any other pain?
He said the pain was in both arms.
Your husband is doing very well. It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any other major illness?
No.
Any bleeding?
No.
Any major surgery?
No. Nothing like that.
Anything else you can think of?
No. Nothing.
Okay.
Oh. Sorry. What? Sorry. No, sorry. Listen again. And okay, this time you can correct these statements too. So these statements are all incorrect. Okay. Sorry.
Unit 9, Listening 1.
He's not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
That's a relief.
I just need to ask you a few quick questions. Can you tell me what happened?
We were sitting at home and he started getting this pain in the center of his chest. He'd had it several times before and he used the spray thing he's got.
The GTN spray.
Yeah, that's it. And so he gave himself a few puffs, but the pain wouldn't go. And I could see that he was getting breathless and agitated, and he said he felt sick. He started vomiting a little, and he was beginning to sweat. And he said he thought he was going to die.
Okay. So can you tell me what time that was?
Well, I called for an ambulance at 7ish, and it came like a shot. So it was less than an hour ago in total.
So has he had any other pain?
He said the pain was in both arms.
Your husband is doing very well. It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any other major illness?
No.
Any bleeding?
No.
Any major surgery?
No. Nothing like that.
Anything else you can think of?
No. Nothing.
Okay. What we're going to need to do, with your consent, is to give your husband something to help get rid of any blood clots. There is a risk of stroke with the procedure, and I want to make sure. But the benefit can be dramatic if we get it down quickly. It can have a considerable effect. There doesn't seem to be any reason why he shouldn't have the medication, but we need to give it as soon as possible, and we need your consent.
Okay. can I just ask one little question?
By the looks of it, it's all gone very well, and he'll be up and about in no time. For the moment, he just needs a bit of rest.
Okay, so can you correct the statement? The patient is in serious condition.
Unit 9, Listening 1.
They were working in the garden when the patient got the pain. And this is the first time the patient has the pain. The patient just felt nauseous. He only complains of having pain on his right chest. The patient underwent a cardiac surgery 2 years ago. The purpose of the procedure is to enlarge an artery. Listen again. Okay.
Not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
That's a relief.
I just need to ask you a few quick questions. Can you tell me what happened?
We were sitting at home and he started getting this pain in the centre of his chest. He'd had it several times before and he used the spray thing he's got.
The GTN spray.
Yeah, that's it. And so he gave himself a few puffs, but the pain wouldn't go. And I could see that he was getting breathless and agitated, and he said he felt sick. He started vomiting a little, and he was beginning to sweat. And he said he thought he was going to die.
Okay. So can you tell me what time that was?
Well, I called for an ambulance at 7ish, and it came like a shot. So it was less than an hour ago in total.
So has he had any other pain?
He said the pain was in both arms.
Your husband is doing very well. It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any other major illness?
No.
Any bleeding?
No.
Any major surgery?
No. Nothing like that.
Anything else you can think of?
No. Nothing.
Okay. What we're going to need to do, with your consent, is to give your husband something to help get rid of any blood clots. There is a risk of stroke with the procedure, and I want to make sure. But the benefit.
Unit 9, Listening 1.
He's not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
That's a relief.
I just need permission, but we need to give it as soon as possible. With your consent, is to give your husband something to help get rid of any blood clots. There is a risk of stroke with the procedure, and I want to make sure. But the benefit can be dramatic if we get it down quickly. It can have a considerable effect. There doesn't seem to be any reason why he shouldn't have the medication, but we need to give it as soon as possible, and we need your consent.
Okay. Can I just ask one question?
By the looks of it, it's all gone very well, and he'll be up and about in no time. For the moment, he just needs a bit of rest.
Yeah. Okay. So, number one is false because the patient is not in serious condition, right? Number two, where were they when the patient got the pain? Is it the first time the patient has the pain? Okay, so I think that you can decide that now. Yeah? Okay, so now listen and check.
Unit 9, Listening 1.
He's not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
Yeah,
That's
so the doctor said that he's okay. and he's stable. The wife, she thinks that he's not okay. He is in serious condition, but actually, so the wife seemed very worried about his condition, right? But the doctor tries to reassure, yes, no, that's okay. Right? So he's okay. He's in stable condition. Okay.
It's a relief.
I just need to ask you a few quick questions. Can you tell me what happened?
We were sitting at home and he started getting this pain in the center of his chest.
Yeah, so they were not working in the garden, but they were sitting at home when he got the pain. Number 3,
He'd had it several times before.
he has said several times before, this is not the first time he has the pain. Okay?
And he used the spray thing he's got.
The GTN spray.
Yeah, that's it. And so he gave himself a few puffs, but the pain wouldn't go. And I could see that he was getting breathless and agitated, and he said he felt sick. He started vomiting a little, and
So he didn't just feel nauseous, but he felt breathless, agitated, and sick, and then he vomited. Yeah, and then he was vomiting, right?
he was beginning to sweat. And he said he thought he was going to die.
She's
Okay.
very worried.
So can you tell me what time that was?
Well, I called for an ambulance at 7ish, and it came like a shot. So it was less than an hour ago in total.
So has he had any other pain?
He said
Number 5. So it happens just about 7:30. Okay.
the pain was in both arms.
Both arms. Yeah, it's not in his right chest, but in his both arms.
Your husband is doing very well. It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any other major illness?
No.
Any bleeding?
No.
Any...
So he hasn't had any major illness? No.
It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any...
Unit 9.
What?
Listening.
anything else you can think of?
No. Nothing.
Okay. Questions.
Okay.
Has your husband had any injuries or any other major illness?
No.
No.
Any bleeding?
Bleeding? No.
No.
Any major surgery?
No.
Yeah, so not a cardiac surgery 2 years ago. He didn't have any surgery.
Nothing like that.
Anything else you can think of?
No. Nothing.
Okay. What we're going to need to do, with your consent, is to give your husband something to help get rid of any blood clots. There is a risk of...
So the purpose of the procedure is to get rid of the blood clot, right? Not to enlarge an artery.
stroke with the procedure, and I want to make sure... But the benefit can be dramatic if we get it down quickly. It can have a considerable effect. There doesn't seem to be any reason why he shouldn't have the medication, but we need to give it as soon as possible, and we need your consent.
Okay. Can I just ask one little question?
By the looks of it, it's all gone very well, and he'll be up and about in no time. For the moment, he just needs a bit of rest.
Okay, so that's it. Yeah, I'm sorry. I need to correct something here first. And now listen again. And this time you should fill in the gaps with suitable words. Now listen.
Unit 9, Listening 1.
He's not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
That's a relief.
I just need to ask you a few quick questions. Can you tell me what happened?
We were sitting at home and he started getting this pain in the centre of his chest. He'd had it several times before and he used the spray thing he's got.
The GTN spray.
Yeah, that's it. And so he gave himself a few puffs, but the pain wouldn't go. And I could see that he was getting breathless and agitated, and he said he felt sick. He started vomiting a little, and he was beginning to sweat. And he said he thought he was going to die.
Okay. So can you tell me what time that was?
Well, I called for an ambulance at 7ish, and it came like a shot. So it was less than an hour ago in total.
So has he had any other pain?
He said the pain was in both arms.
Your husband is doing very well. It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any other major illness?
No.
Any bleeding?
No.
Any major surgery?
No. Nothing like that.
Anything else you can think of?
No. Nothing.
Okay. What we're going to need to do, with your consent, is to give your husband something to help get rid of any blood clots. There is a risk of stroke with the procedure, and I want to make sure. But the benefit can be dramatic if we get it down quickly. It can have a considerable effect. There doesn't seem to be any reason why he shouldn't have the medication, but we need to give it as soon as possible, and we need your consent.
Okay. Can I just ask one little question?
By the looks of it, it's all gone very well, and he'll be up and about in no time. For the moment, he just needs a bit of rest.
Yeah, okay. So, can you complete that? Or we should listen one more time? I think you can do that now, right? Now listen. Jack and Jack.
Unit 9, Listening 1.
He's not very well at all, is he, Doctor?
He's actually okay. He's a bit more stable.
That's
Right. So this is number one. Yeah, he's a bit more stable. Yeah.
a relief.
I just need to ask you a few quick questions. Can you tell me what happened?
We were sitting at home and he started getting this pain in the centre of his chest.
Right. So in the center of his chest.
He'd had it several times before and he used the spray thing he's got.
The GTN spray.
Yeah, that's it. And so he gave himself a few puffs, but the pain wouldn't go. And I could see that he was getting breathless and agitated, and he
So he was getting breathless. Huh.
said he felt sick. He started vomiting a little, and he was beginning to sweat. And he
He began to sweat. Mhm.
said he thought he was going to die.
Okay, so can you tell me what time that was?
Well, I called for an ambulance at 7ish, and it
Yeah.
came
She called for an ambulance. Yeah.
like a shot. So it was less than an hour ago in total.
So has he had any other pain?
He said the pain was in both arms.
Both arms. Right?
Your husband is doing very well. It's good you got him straight into hospital. But I need to ask you a few quick questions.
Okay.
Has your husband had any injuries or any other major illness?
Right. So you see the injuries. Right.
No.
Any bleeding?
No.
Any major surgery?
Any major surgery? Uh-huh.
No. Nothing like that.
Anything else you can think of?
No. Nothing.
Okay. What we're going to need to do, with your consent, is to give your husband something to help get rid of any blood clots. There is a risk of stroke with the procedure, and
The risk of stroke. Yeah.
I want to make sure. But the benefit can be dramatic if we get it down quickly. It can have a considerable effect. There doesn't seem to be any reason why he shouldn't have the medication, but
The medication. Yeah.
we need to give it as soon as possible, and we need your consent.
Okay. Can I just ask one little question?
By the looks of it, it's all gone very well, and he'll be up and about in no time. For the moment, he just needs a bit of rest.
Yeah. Okay. So that's all for listening. Huh? So you can see that the doctor tried to reassure the patient's wife because she seemed to be very worried about his condition. Okay. Yeah. And yeah, so we did some things about true phone and complete the conversation actually. Yet, okay. So that's all for listening. Okay. Thank you. But actually, we should work in pairs and take turns role play the conversation. So one of you is the patient and one of you is the doctor in role play the conversation again. But I don't know whether this year we have a speaking test or not. Last year we didn't, but the years before we had the speaking test. I don't know this year. I will ask about that. Now we move to the next block. Do you need a okay? Yeah. Do you need a break? Sometime 5 minutes? Okay, I don't think you.
Unit 9. Listening 1.
He's not very well at all, is he, Doctor?
do you think you can answer the questions here? Yeah, I think I should give you about 10 minutes, yeah? And see whether you can answer the questions here. How much does an average adult heart weigh? What do you think, A or B or C? Number 2, which heart rate is normal for a resting newborn baby? How much blood do we have in our bodies? How long does it take blood to get around the body? What percentage of blood is water? What causes the lap, 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 lap sounds that you hear through the stethoscope? What should the maximum heart rate be for 20 years old when exercising? A, B, C. So you should check A, B, C. Whose heart beat faster? Women's, men's, or both the same? When was the first successful what? Heart transplant carried out? And what percentage of body blood is held in the heart at any moment? So I think you should spend about some time looking this, okay? Oh no. No.
Cô ơi, không nghe cô nói gì hết á cô.
No, I turn off the mic because I want you to do this, okay? So I think you should spend some time looking at the question and find the answers, okay? So I turn off my mic. Yeah. Actually, number one is the A. Number two, this is B. Number three, A. Number four, A. Sorry. So an average adult heart rate 225 grams. The heart rate in normal for a newborn baby is for 140 beats per minute. Beats per minute. We have 5 liters of blood in our bodies, and it takes 20 seconds. The blood. Oh, yeah, that's good. Thank you. So in number 5, %78, huh? Number 6, number opening and closing valves. Number 7, here 200 beats per minute. The maximum rates for a 20 years old when exercising. And women's heart beat faster. The first cell phone in 1967, and the percentage, 7%. Or some of you did that. Thank you very much. Yeah, thank you very much. Some of you did the questionnaire. Oh, that's good. You answer the questions. Thank you very much. Sorry, it's not the questionnaire, it's just questions. I'm sorry. Now, so we finished part 1, listening. Now we move to the second part, is vocabulary. So in this session, we try to avoid technical terms. So when you talk to patients, they are lay people and they don't understand technical terms. So we should try to avoid using technical terms when we talk to patients. So first of all, you can see that in these sentences, the speaker is trying to avoid using one of the technical words or phrases in the list below. So first of all, you should look at the meanings of the technical terms here in Camlet. Try to use the other, try to replace the word. Hypokalemia. means a deficiency of potassium in the blood. Gọi là giảm canxi huyết, titrate or the verbs and titration is here now. Yeah, this is a method of finding exactly how much of a substance there is in a solution by gradually adding measured amounts of another substance that reacts to it in another way. For example, by causing a color change. And Vietnamese equivalent is that mean that. Diuretic, tending to increase the excretion of the urine. Contraindication means something so that a symptom or condition that makes a particular treatment or procedure inadvisable. An indication is the opposite of contraindication. Yeah, that's make it desirable. And here is inadvisable, and here is desirable. This is the opposites. They are the opposites. Yeah. Aphasia. This is a medical condition in which the heart does not beat with a regular rhythm at the normal rate. This is arrhythmia. Line. Venous access. Reperfusion. And now it's reperfusion. This is the restoration of the flow of blood. Oh my. Sorry. To a previously ischemic tissue or organ. So thrombolysis, the destroying or breaking up a thrombus. Thrombus is a blood clot. And thrombolysis is destroying or breaking up a thrombus. And when you say tolerate, it means to have a tolerance for example, a substance or pathogen. As we say, tolerate. So when we talk to each other, when you talk to each other, you can use these words. They are technical terms. But when you talk to patients, you shouldn't use these because they don't understand. We don't understand. We are lay people. We don't understand a technical term. So you should avoid using them. So we look at the sentences here and here. This is a speaker is trying to avoid using the technical words here. But so now we look at the words and match the word to a sentence. Yeah, okay. So I think you should spend about 10 minutes here. Oh my mama. So what's the okay? Yeah, thank you. Yeah, thank you. Yeah, you should spend about 10 minutes here. Yeah, thank you. Thank you very much. Yeah, thank you very much. Yeah, sorry, not cancer, kali, potassium. Yeah, sorry. Thank you. Yeah, thank you so much. I'm sorry. Yeah, potassium, kali. Sorry. So a deficiency of potassium in the blood, hypokalemia. Hạ kali máu ha. Yeah, sorry. Thank you. So we need some time. I think that you should spend some time and try to replace the phrases and the words here. For example, if we can give him, if we can give him a drug to dissolve any clots, then we increase his chances of getting better. So usually he is a doctor and he is trying to explain to the relative, right? Maybe wife, maybe husband, yet. So when you say if we can, we give him a drug to dissolve any clots, then we increase his chances of getting better. So you should replace the words clot here with the thrombolytic to dissolve the to thrombolytic to dissolve the clot mean thrombolytic. How about number 2, number 3, number 4, 5, 6, 7, 8, 9, and 10? Huh? I think you should spend some time doing this, okay? Thank you. Maybe 10 minutes. Thank you. Yeah, thank you very much. I received some of your answers, and that's good. You did very well. Yeah, anyway, we check these sentences. Huh? Now, so number one, if we give him a drug to dissolve any class, then we increase his chances of getting better. So we replace with thrombolytic. I mean, this person is trying to avoid using the technical word. We can use that, and they say thrombolytic. I mean, sorry, you are professional, and you can, yeah, you can use thrombolytic. Huh? Number two, my heart is not beating in a normal rhythm. So we know that not beat in a normal rhythm. You see, uh, arrhythmia, Huh? So you see, my heart is not beating in a normal rhythm. Number three, there are several reasons why this drug should not be used. So it should not be used. Sorry. Oh, thank you. Thank you. Yeah, I received some more answer. Thank you. Yeah. So when you say it should not be used, so it's a contraindication. Yes. So I can find that. Many of you did very well. Huh? You did well. Number four, you have no side effects with this drug. So it means that, yeah, you tolerate with this drug. So number four is JJ. Yeah, that's good. Some of you did correctly. Number five, we are going to give you something to help reduce swelling in your ankles. So reduce the swelling is diuretic, huh? Yeah, to have reduced the swelling. So something that have reduced the swelling is the diuretic. As soon as the patient is brought in, we need to get into a vent. So when you say to get into a vent, you can say that the secure venous access. Huh? Secure venous access, it means to get into a vein. Number seven, we will increase the painkiller by the same amount each time until it kicks in. So until it kicks in, it means to titrate, to effect, until it kicks in. This drug will get the blood flowing back again through the heart. So when you say something is flowing back again through the heart, it means reperfusion. Mean to flow back again. If this doesn't work, we move on to the next stage of treatment. So when you say the next stage, it means this is the line of the treatment. And you got very low levels of potassium, so it means that hypokalemia. And you got hypokalemia, very low levels of potassium. Oh, thank you very much. Yeah, so some of you did very well. I mean that you try to do that, and it is very good. Thank you very much. Yeah, maybe there are some wrong answers, but that's okay. So who can translate these into Vietnamese? I mean, to have other people who, yeah, No, you don't need to use these in Vietnamese. Do you need to? No, that's okay. But I don't understand the word reperfuse. Can you give a Vietnamese equivalent for this? Reperfuse. So I will ask you about these. Okay. So yeah, I think that I need your help with these. Where is it? So you know that some of these questions will be in your tests. So maybe you should learn. Thank you very much. Tái tưới máu. Yeah, thank you. So I think I should try the Vietnamese equivalent here, right? Yeah, thank you. Thank you very much. Okay. Yeah, thank you. So you understand all these sentences, right? Okay. So that's all. That's okay, right? Okay, so that's all for vocabulary. Yeah. Remember, yeah, some of the words here. Okay. And so anybody here would need to understand these sentences in Vietnamese so that it's easier when you learn by heart. So if you need any other students in the class can help. I mean, I don't, but I think other students in the class can help. All right. So if you need any help, so let us know. I mean, tell the class that, yeah, maybe you, some of the students, I mean, should translate this sentence into Vietnamese. No? So I mean that you understand on these. Okay, thank you very much. So I think we need a break. Yes, we need a break about 15 minutes. Okay. Yeah, I think you should need a break. So we will have a 15-minute breaks and we move to the next part to see the grammar. Thank you. Yeah, have a break. Yeah. Yeah. Let's come back. Let's continue. The grammar point is about the future. This language spot is it grammar? Huh? About the future. Now look at your book and see what tenses are used in the sentences. Part 1. What tenses are used in these sentences? The war out starts at 10. So we have half an hour. So we know that this tense starts here. This is the present simple. She normally stops at 12, but today I think she'll have finished her rounds well before 11:30. So we call this the future perfect. Will have finished. Number 3, the workout is finishing at 12 noon. So is finishing. This is the present continuous. So we'll definitely be sitting in the canteen at 1:10. So we'll be sitting. We call this the future continuous. And we'll have been working for 12 hours by 1 this afternoon. So we'll have been working. We call this the future perfect continuous. So all of these tenses can be used to talk about the future. The simple present, present continuous, simple future, future continuous, future perfect, and future perfect continuous. All of these can be used to talk about the future. So we can use the present continuous for arrangement. For example, we are driving to Berlin this weekend. So this is an arrangement, and you can use the present continuous. Or you can use a future simple for and usually this is for prediction or request or decision made now at the time of speaking, or talks about fast about future. For example, you say you will have great time there. Become this the future simple. Huh? Right. And this is a prediction, but you can also use future simple for requests. for decision made at the time of speaking or facts about future. We can use be go into, and usually we use be go into to talk about prediction with evidence or intention, plans, and facts about future. For example, it's going to rain, so take an umbrella. So this is a prediction but based on evidence. For example, you may see lots of dark clouds. So you say it's going to rain. We also use be going to for intention or plans and for facts about future. We also can use the present simple, especially with timetable. For example, say my plane leaves at 6 p.m. Yeah, so when we see a timetable, we should use the present simple to talk. But is it the future, not present? Or we can use the future perfect simple. For example, I will have worked at the company for exactly 25 years. So this is a continuing situation up to a certain time. And the certain time here is this time next month. So usually when we use the present perfect simple, it should have a phrase like by the end of something. Usually by the end or by something. Because we want to talk about a completed situations before a certain time. For example, if Logs at J will have lost his job by the end of the week. So when you see by something, so you should use the future perfect simple. And the future perfect continuous is usually used to emphasize the duration of an action. So usually we use with work, wait, live, something like that. Because you want to emphasize the duration of an action. For example, this time next month. So it's just the same as the future perfect simple, but you want to emphasize the duration. So you say this time next month, I will have been working at the company for exactly 25 years. So it's about the same. But with this sentence, you want to emphasize that it's a very long time. Right? You want to emphasize the duration, and you use the present perfect continuous instead of the future perfect continuous instead of future perfect simple. Okay, so these are some tenses that can be used for the future. And if you want to learn more about these, I think you should have a look at some kind of grammar book. Okay. But anyway, there are a lot of exercise here in our book. So we look at number 2 and number 3. We have some exercise here in our book. I think a lot, yeah. So look at number 2. Oh, sorry. We also use future continuous, And future continuous usually used to talk about a situation in progress at a certain time in the future. So again, this time next week, or this time next week, I will be traveling around Russia on business. So this is something that will be happening. It means the situation in progress this time next week. Yeah. Or you can talk about habits at a point in the future. Like, I think in the future, more and more people will be commuting. Okay, something. Yeah. So if you want to use the present, the future continuous, so there should be a time, an exact time in the future. And this is something that is progress, will be happening. So we use the future continuous. And will be and put in. Okay. Now, because there are lots of exercise in our book, so I think that's enough. We can do the exercise here in our book. Now look at number 2. Work in pairs. Read all the sentences below. 1, 2, 3, 4, 5, 6. And then match them with a relevant points of periods on the diagram. We did it. You look at number 2 here. Right, so you match 1, 2, 3, 4, 5, 6. And here A, B, C, D, E, F, G, H. Or A, B, C, D, something like that. Yeah, if it is the periods. So you will have to write the periods. For example, from A to B, it means from 9 to 10. Yeah, or periods like 2 p.m. until 6 p.m. So it means that you have to write F and G. Or a point, for example, 1 p.m. So you write E. Okay, so I think you should spend about 10 minutes. Yeah. For example, Sorry. Sorry, there's someone at the door, so I have to answer. For example, number 1, you say we will have 8 hours on duty by the end of the day. So 8 hours is from 9 a.m. until 7 p.m. So when you say by the end of the day, so it means 7 p.m. So you write here is a point. Okay, so we continue for number 2. Number 3. So you should write a point like that, or a period. It is from 2 p.m. until 6 p.m. So it's a period. In we say by the end of the day, so we use future perfect, simple. We will have had. Okay, like that. So I think you should spend 10 minutes here. Thank you. Yeah. Any question? Yeah, that's good. Thank you, Thái. Yeah, I received some answer from Thái. Thank you. Oh, now number 2. You say we are having an hour for lunch. So because it is an hour, so it cannot be a point, but it's a period. So for lunch, it should be from 1 to 2, right? Noon, from noon to 1. So this is from D to E, the 1 hour. Number 3, so we are having, this is the arrangement. Number 3, we all have just finished lunch by the time the consultant arrives for her warehouse. So the consultant arrived for the warehouse, so it should be here. So 1 p.m. So you see you see 1 p.m. We finished lunch here. So by the time, so we use the future perfect. We will have just finished lunch. The weekly presentation work will last 2 hours. We end just before lunch. So it ends before lunch. So we see that it is here, the lunch at 12 noon. So it's here before lunch. Here, just here. What do you mean, Miss Nguyễn? What do you mean? I see. What do you mean? Number 5. The Dr. Ian Garfield will be starting the presentation as soon as he arrives. In the shift today starts at 10 with a presentation. So the presentation with a presentation, and then he will start the conversation as soon as he arrives. So it should be here at 10 a.m. And this is the time that the shift starts with a presentation at 10. So it's also at 10 here, 10. So this is how we use the time, a point of time or the periods of time to talk about the future. I will have had, by the end we are having, I will have just finished, by the time, will last, will be starting, yes, starts at. So these are the tenses that you can use for the future, and these are the some time expression that can be used for the future. Sorry, what do you mean, Nguyễn? A and C, what do you mean? Sorry, I don't understand what you mean here. What do you mean? Yeah. Oh, thank you. And now we look at the next part. You have to put the words in the future form. Maybe it's active, maybe passive. And use the correct tenses. So it's a bit difficult. Okay. You should spend some time having a look at this, right? If his progress so far is anything to go by, he, so say, will be up and about in a few days. So up and about, it means feel well enough to get out of bed and move around. So it means up and about. Mình say khỏe. Say he will be up and about in a few days. In a few days. It's when you talk about the future, when you in here is the future. Trong mấy ngày nữa. In a few days. Nếu mà có tiến triển như vậy ha, thì ảnh sẽ ngồi dậy được, đi loanh quanh nhé. Trong mấy ngày nữa. So it's in a few days. So we use the future simple. And home this Saturday. So he will be sent home this Saturday. He, the same. So it should be in passive. So number 3, number 4, yeah. I think you should have a look at that. Okay. Thank you. Yeah, okay. Thank you, Phạm, yeah, for your answers. Thank you very much. Now we look at number 3. She soon move out of intensive care. So we say she will soon move or will soon be moving out of intensive care. She will soon move or soon be moving out of intensive care. So you mean that we should use the passive here, right? Yeah, Thái and Phạm, yeah, something. Yeah, you mean that we should use the yeah, but I think that yeah, you can use, but you mean that the doctor's medical staff will move her, right? Yeah, so I think yeah, it makes sense. Yeah, we should be moved out of intensive care. It's difficult for her to move herself, right? Oh, okay. Yeah, I agree. Now, number 4, that means in 10 minutes is roughly 60 minutes since the pain first came on. So, will have been. Okay, yeah, that's good. Or we can also say will be, but will have been. Yeah, that's good. Yeah. In 10 minutes, trong 10 phút nữa thì là 60 phút từ lúc mà bị đau như vậy. Yeah, number 5, he walked around without any problem in a matter of days. Mấy ngày thôi. So they will be walking. We don't say walks because when we say the present simple, we usually talk about timetable, right? So we say he will be walking, yeah, but don't say he walks, yeah, because again the simple present usually used for timetable, right? Not for this thing. Yeah, he will be walking around without any problem in a matter of days. Number 6, go into a rehabilitation unit before he comes out. So actually say will he be able? Will he be able? Oh, we don't say will have been able. Will he be able? Yeah, to go. Cái đơn vị phục hồi ha. Before he comes out. Yeah. Yes, good. Thank you very much. Yeah, thank you. Number 7, what he have to eat by the time I get there today. So say what will he have because that's by the time I get there today. So by the time, so that's why we should use will have had. We have had. Yeah, pay attention to this phrase, by the time I get there today. So when you say something about by, so you should use the perfect simple or continuous. The consultant is coming, or you say comes, round at about 10 p.m. Because this is a timetable, so you can say comes. Because he usually does it, or you can say is coming. So we will see him, or you say we will be. Oh no, sorry. Sorry. So you say you will see him or will be seeing him around 1 p.m. Okay, yeah. Then Then when you say then here, it's about 1 p.m. So you can use the future continuous because we know the time. Yeah. Then here, I mean 1 p.m. So you can use will be seeing, but it's okay if you can say you will see him. That's okay. Oh, thank you very much. Some of you did very well. I mean, there are some mistakes, but that's okay. Okay, that's good. Grammar, I mean, about the tenses are very difficult. Yeah, to distinguish between this tense and the other tense. It's very difficult. Yeah, you did well. Thank you. Thank you very much. Now we look at another here. It's easy because, for example, they say that you should use the future. So you say, yeah, just wait here and I will get the doctor for you. Future perfect. So it's just to practice the forms of the tenses. So easy. This exercise is easy. Anyway, I think you should have a look about 5 minutes here. Thank you. For example, Dr. Adam, future perfect. So you say will have ended, right? The lecture on hypertension. Right, just like that. For present simple, so we say Professor Gomez sees, right, her PhD students. Present continuous and with undergo, so we say is both. She is undergoing, the operation, right? And worked, and for future perfect continuous, so say I will have been working. I will have been working on this. Sorry, I think I need the book. In the clinic in the future, so say the clinic will open when the consultant arrives. And number 7 is for future perfect. So it's medicine will have advanced, considerably. And here for future continuous, so we say you will be leading a normal life. So this is easy, but the more difficult is the next exercise. Okay. So it's more difficult. So you have to match a sentence here. Yeah, we just did these sentences. We have just done these. But you have to complete the sentences here with a time expression here, right? In a few minutes, by 2030, immediately, on Fridays this month, for 2 years now, next month, by 5 p.m. in a matter of days, at 2 p.m. this Friday. Yeah, you have to complete these sentences. And this is more difficult, right? And we have just did, we have just done these. Okay, so I think you should spend about 5 minutes here. For example, number 1, just wait here and I will get the doctor for you. So what do you think? Which phrase or which word should we use? Wait here and I will get the doctor for you. So, oh no, okay. Yeah, I think you should do this. I don't know, I did this or not. Yeah, I will check that. Yeah, thank you. So have a look at that and match a sentence with a phrase. So, sorry, I have to check that again. So wait a minute. Thank you. Yeah. Okay. So yeah, just wait here, and I will get the doctor for you immediately. Number 2. Dr. Adam will have ended the lecture by 5 p.m. That's good. Yeah. 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 And number 3, Professor Gomez. So the present simple, with present simple. So we know that with present simple, yeah, we should say this on Fridays. I mean every Friday this month. Sees. So I think you should look at the tenses. Yeah. Sees. So this is a present simple. So we on Fridays. I mean every Friday this month. Yeah, so you did very well. Thank you. Number 4, present continuous. And when we use the present continuous, so it's book. She okay. So with present continuous, so we should say she is undergoing the operation at 2 p.m. this Friday. That this is a plan or intention, right? And number 5, this is a future perfect continuous. Yeah. So you say, I will have been working on this wall for 2 years now, next month. Tính đến ha, tính đến tháng sau là tôi đã làm việc cho cái chỗ này 2 năm ha. So say I will have been working for 2 years now, next month. And number 6, with future, will, the future symbol. So the clinic will open when the consultant arrives in a few minutes. In a few minutes. Yeah. Good. Yeah, some of you did well. Number 7, future perfect. So when you the future perfect, you usually use by something. Yeah. So that's why I say medicine will have an advanced considerably by. Yeah, that's good. Number 7. I think many of you did. All of you, yeah, did this sentence correctly. Yeah, by. And the last one, for the future continuous. So you say, yeah, he will be leading a normal life in a matter of days. Yeah, correct. Yeah. So you did very well. Okay. Yeah. Thank you very much. Yeah, for exercise 4. Yeah. But it's difficult, right? It's difficult. So I think that's all for today. But we have to do this for production. You should write a paragraph about your situation in the next 5 years. Yeah, of course it's imaginary. Yeah. But in the next 5 years, so you should use the future. And you can use the future, the present continuous, be going to, future simple, future perfect simple, future perfect continuous, and future continuous. Okay, to talk about the situation, your situation in the next 5 years. Yeah, so that's all for today. We did listening, we did vocabulary. Oh, we didn't do this. Next time. We did the language sport, the future. So I think that's all for today. She did that. Hằng. She did that. Okay, thank you. Yeah. Sorry. Sorry. Sorry, did you say anything? Yeah, but I think the sound is not very good. We couldn't hear. Okay, thank you. Ok, thì xin nhắc lại một tí nha. Không biết là không biết cô Hằng nhắc chưa, nhưng mà xin nhắc lại một tí là cái phần thi của mình á, là mấy năm trước á, là thi cả 4 kỹ năng nha, nghe nói đọc viết luôn. Nhưng mà 2 năm gần đây thì do dịch á, thì không có thi nói, mà làm mới đây thôi. Chứ còn trước đây thì trước đây là lớp cao học nội trú luôn. Còn giờ thì nghe nói chỉ có bác sĩ nội trú mới học ha. Thì trước là mình thi là vốn là cả 4 kỹ năng nha. Thành ra không biết cái đợt tới đây thì có thi nói không. Thì nếu có thì mình sẽ nhắc mấy anh chị là sẽ thi như thế nào. Tại vì mọi năm cũng vậy, nghĩa là mình chỉ thi cái gì học thì thi. Nhưng mà chương trình thì thay đổi rất là nhiều, thành ra ấy là cứ mỗi năm cứ mỗi thầy à. Nên nói chung là khi nào có thông báo thì sẽ thông báo nha. Còn cái phần thi bình thường. Dạ. Sao ạ? Dạ.
Là đối tượng thì có được thi không?
Dạ sao ạ?
Đối tượng hàng tháng thì không thông báo thì học thi đó cô. Chị mới có thông báo cho bác sĩ nội trú và chuyên khoa 1 đó cô.
Là
thì,
sao ạ? Dạ.
Ý là cái đối tượng miễn học miễn thi thì có được dành cho thạc sĩ không cô?
Theo như mình biết là thì cái thi này là chỉ có bác sĩ nội trú thi, chứ cao học là giờ đâu có thi đâu. Cao học là phải nộp bằng á. Thì cái này thì mình thấy là ngay từ đầu, ý là cái lúc mà thi vô đã vậy rồi. Có nghĩa là đợt vừa rồi thi đầu vào đó thì như mình đi chấm thi thì mình chỉ chấm bác sĩ, thấy chỉ có bác sĩ nội trú thôi. Còn cao học là không thấy không thi vô luôn, thì chắc là cũng không thi ra luôn.
Dạ lúc đó là cao học nộp bằng đó cô, nhưng mà tại vì lại không có thi là đúng. Nhưng mà ý là bây giờ trong quá trình học đó, thì cao học có môn này
chắc cũng vậy. Mình nghe nói là cũng vậy, nghĩa là lúc đầu lớp này vốn là lớp cao học và nội trú, nhưng mà bây giờ mình nghe nói là lớp này là chỉ nội trú thôi chứ không có cao học. Thì thành ra cái này mình cũng chưa rõ, là để mình hỏi lại nha. Và
dạ,
thêm nữa là bạn cũng hỏi lại bên bác gì đó, bác Quang thử như thế nào.
Em có hỏi bác Quang, nhưng mà bác Quang nói là cao học thì vẫn phải chờ theo cái thông báo. Tại vì chị mới có thông báo cho bác sĩ nội trú với lại cho chuyên khoa 1 thông báo chính thức thôi, còn cao học thì vẫn đang họp. Nên
là chưa biết. Vậy là mình cũng chưa biết luôn, nhưng mà mình cũng nghe nói là cái lớp này là lớp bác sĩ nội trú, nghĩa là giờ thấy không có ghi là cao học nữa.
Vậy.
Dạ.
Có gì nhờ cô hỏi giúp tụi em. Hơi hoang mang hết cô.
Dạ đúng không, là thì trước mình khi nào mà có thông báo cái là tụi mình sẽ thông báo liền. Nhưng mà hiện giờ theo như mình biết là lớp này thì gọi là lớp nội trú chứ không phải là cao học. Trước đây nha, mấy năm trước là cao học nội trú, có nghĩa là trong này có đối tượng là cao học nữa. Nhưng mà riêng năm nay thì thấy không có ghi chữ cao học nữa, mà chỉ là bác sĩ nội trú, nên mình nghĩ là nội trú là chắc phải nộp bằng chứ không có học. Dạ.
Tụi em là cao học cô, cao học điều dưỡng, mà học vậy rồi không biết cuối cùng thi như thế nào thì không biết.
Dạ. Điều dưỡng thì mọi năm là điều dưỡng là học riêng á, điều dưỡng là có một cái lớp riêng luôn á. Thành ra là
tụi em học chung cái này từ đầu chí cuối, nhiều lúc theo bác sĩ nó cũng có những cái từ khó hiểu á cô.
Vậy thì nếu mà chỗ nào có khó hiểu á, mấy anh chị hỏi lại nha. Tại vì thường mình nghe cô Hằng bảo là ở trong đây thấy mấy anh chị kia thấy mấy anh chị khá lắm, ý là tốt lắm, thành ra là thấy nói toàn tiếng Anh không à. Thì thành ra nếu mà chỗ nào mà mình cảm thấy mình không hiểu lắm thì mình hỏi lại nha. Tại do mình cũng chủ quan nghĩ là Dạ chắc là dạ thì không sao ạ.
Không thì tụi em thì cũng học thì cũng theo thôi, nhưng mà cuối cùng thì vẫn thi bình thường phải không cô? Vẫn thi 4 kỹ năng hay là chỉ 3 kỹ năng thôi?
Chưa biết đó, thì mình nói là chưa biết đó. Mình nói là chưa biết tại do là 2 năm gần đây thì không thi nói. Còn mấy năm trước là có nha, có luôn. Mấy năm trước là thi 4 kỹ năng á, năm nào cũng thi 4 kỹ năng hết. Dạ, không, nhưng ý là mình nói là nếu mà có chỗ nào khó, ví dụ hồi nãy cái phần từ vựng nó thật sự mình thấy có chỗ khó đó. Ý là có chỗ mình thấy mình đọc lên mình thấy cũng rất là khó hiểu. Thành ra là nhắc lại là nếu mà các anh chị thấy có chỗ khó thì các anh chị cứ hỏi lại nha. Ý là các anh chị cứ hỏi lại chứ đừng có ngại, có mấy anh chị khác ở trong lớp sẽ giải thích cho mình, thì thường thì các anh chị sẽ giải thích rõ hơn luôn. Vậy đó, ý mình là vậy. Chứ không phải là khó, nhưng mà
cũng nhờ cô
chỉ
hỏi giúp cái chỗ bên bộ môn hoặc là bên trường thử là không biết là khi nào có thông báo của bên đối tượng thạc sĩ, cô nhờ cô hỏi giúp.
Dạ thì thì sẽ hỏi, nhưng mà nếu mà bác Quang bảo là đang họp, có nữa là họ chưa ra quyết định. Dạ nhưng mà vậy thì nếu mà là nộp bằng á thì còn khó hơn học ở đây ấy chứ. Phải không? Nếu mà phải nộp
có bằng rồi đó cô.
thì có bằng rồi thì tốt, nhưng mà dạ nhưng mà tại thấy vừa rồi đợt thi đầu vào là chỉ có nội trú thôi, chứ bằng bên cao học là phải nộp bằng hết rồi mà ha, nên nghĩ là chắc đâu có đâu. Dạ chưa biết nha. Vậy nếu mà bên Bắc Quang bảo là chưa biết thì bên bộ môn cũng chưa biết luôn. Dạ thì có gì mình sẽ báo, nhưng mà mình chỉ nhắc là thi thì hiện giờ là chưa biết là có thi nói không, chứ nghe đọc viết thì là có ha. Nghe thì ví dụ có nghe 2 bài thì có 1 bài trong sách, ý là những cái bài ví dụ hồi nãy cái bài mình nghe nãy đó thì là có thể là nằm trong bài thi, với là 1 bài là ở ngoài. Đọc cũng vậy, từ vựng ngữ pháp cũng vậy, ý là từ vựng ngữ pháp thì hoàn toàn trong sách luôn, ý là ví dụ những cái câu mình làm hồi nãy đó thì sau này thì sẽ thi luôn, thì nó nằm 20 câu ha. Còn cái phần viết thì tuần sau mình mới bắt đầu học cái về phần viết ha, thì mình sẽ nhắc. Vậy cũng vậy thế, tại do không biết là mình có phải thi không, mà như mình học thì ý là nếu mà mình không thi thì mình học cũng mệt, phải không? Thì mình sẽ hỏi thử nha, để mình sẽ xíu nữa mình sẽ nhắn cô bên kia thử, cái cô bên bộ môn mình á, hỏi thử có quyết định gì về cao học này không. Nhưng
dạ,
mà
cô ơi.
dạ
cô nghe em rõ không cô?
Dạ nghe.
Dạ ý là bữa trước năm ngoái em có nghe nói là cái bằng IELTS bên mấy khóa trước là không có thẩm định được đó cô, mà tại vì cái đợt này tụi em nhập học cao học là có nộp cả IELTS hoặc là mấy cái bằng BSTEP này nọ luôn á, nên em không biết là bên mình đã có thẩm định được cái đó chưa cô?
Ủa sao lại đó mà phải thẩm định ta? Tại vì cái bằng IELTS nó uy tín lắm chứ sao là phải thẩm định nhỉ?
Em cũng không biết nữa, tại vì mấy khóa trước thì những cái bạn nộp VSTEP thì được, còn IELTS thì không có được. Nghe nói là phải thi.
Cái gì mới được hả? Cái gì mới được hả?
Dạ, VSTEP thì được, còn mấy bạn nộp IELTS thì không được á.
Really? Vậy hả?
Em cũng hơi bất ngờ nha mấy bạn. Dạ.
Hay vậy?
Nên là em cũng hơi thắc mắc cái chỗ đó, tại vì tụi em nộp đầu vào là có cả VSTEP lẫn IELTS, nên là nếu mà vậy thì mấy bạn nộp IELTS thì chắc phải.
Ủa hay vậy?
Dạ. Dạ. Có bạn nói trong khung chat là VSTEP theo Việt Nam nên là được, còn IELTS là của nước ngoài.
Cái này lạ lắm luôn á nha. Tại vì
em cũng thấy lạ.
Yes. Thiệt chứ. Thường cái bằng Việt Nam thì rất là đáng ghi. Thật ra là thường có nhiều trường nó không nhận ấy chứ, trường mình thì ngược lại. Ui vậy. Thì vậy thì để hỏi thử nha. Nói chung là về cái bằng đó thì mình cũng không rõ lắm, nhưng mà mình theo như mình biết là cái lớp này, như là cái lớp này gọi là lớp nội trú. Lớp bác sĩ nội trú, nên mình nghi là trong này không, lớp cao học không có phải học. Mình nghi vậy, ý là nên là có nghĩa là các anh chị đã có nộp bài rồi thì nộp nộp bằng rồi thì ok. Nhưng mà đúng, cái bằng là nó có thời hạn nha, bằng là nó có 2 năm. Dạ đúng rồi. Nghĩa là nếu mà các anh chị mà cảm thấy tới ngày mình ra trường mà nó 2 năm, nó quá 2 năm là mình phải thi lại. Thì cái này sorry là bộ môn chưa biết luôn, Thành ra có gì mình sẽ hỏi nha. Như vậy có 2 cái mình sẽ hỏi là lớp cao học thì sao ha? Trong đây có lớp cao học điều dưỡng vâng, là thì các anh chị chắc là thường là muốn biết là mình có thi hay không để học. Với nữa là có thi môn speaking không ha. Dạ. Vậy thì mình sẽ hỏi sớm và sẽ thông báo sớm. Thì họ hỏi được là thông báo liền nha. Nhưng mà nếu mà bác Quang bảo là chưa thì chắc là chưa quá. Dạ, cao học ha. Dạ.
Anh hỏi bác Quang nhiều lần rồi đó cô, mà bác Quang nói chờ không mà cô, mà mới có thông báo của chuyên khoa 1 với nội trú rồi cô, còn cao học thì không có nghe, mấy bạn cũng hoang mang đó cô.
Đúng rồi đó, mình cũng nghĩ vậy á. Thì mình theo như mình biết là lớp này là lớp nội trú, ý là cái lớp Anh văn này thì lớp nội trú thì nó là vốn ít lắm. Thì thành ra mình cũng có hôm trước mình cũng có nói là cái lớp nội trú thì ít lắm chứ mà học thì học nhiều thì lại là cao học ha. Yeah. Nhưng mà đều đúng là tự nhiên mình đi học mà không biết mình có thi không cũng mất công nữa. Yeah, thì để mình sẽ hỏi lại. Nhưng mà nghe thấy trong lịch là như ngày 10 mấy tháng 6 là mình thi rồi, nên là mình học xong là mình thi luôn hay sao đó, phải không ta? Không, mình như lớp chuyên khoa 1 mới vậy. Lớp mình thì như tháng 7 mới thi. Rồi mình sẽ hỏi và sẽ thông báo sớm nha. Sẽ thông báo sớm ha.
Dạ, em cảm ơn cô.
Dạ
thưa cô.
Vậy dạ
thưa cô, trước nghe cô Hằng nói là học gì thi đó mà cô nói thi là cho 50% ở trong, 50% ở ngoài. Vậy ở ngoài là những cái mình đã được học hay là chưa được học gì luôn cô?
Cái bài ở ngoài thì tại phải có bài ở ngoài. Ví dụ như bài nghe đi 2 bài thì có 1 bài sách với bài ở ngoài. Bài đọc cũng vậy, nhưng mà cái phần từ vựng với là phần ngữ pháp thì toàn bộ trong sách hết, thì thành ra nó khoảng 30% ở ngoài thôi. Nhưng ngoài có nghĩa là dạ cái trình độ là tương đương, nhưng mà ví dụ một cái bài mà mình chưa biết vậy thôi. Thì cái
nhưng mà mình đã được học luôn hả cô? Ý là những cái mà ở ngoài là mình có trong quá trình mình học những buổi gì có được học
không. Nhưng mà ý là nó tương đương, ý là trình độ là tương đương, cũng kể dễ hoặc khó gì tương đương với trong cái mấy bài trong sách. Dạ, nhưng mà không có biết. thì khoảng là 1 bài nghe với 1 bài đọc thôi, mấy năm trước là vậy á.
Dạ, em cảm ơn cô ạ.
Dạ. Cái bằng F gì? First certificate đúng không? Cái bằng đó là được chứ. Nó nếu mà đạt một cái điểm nào đó thì là được, tương đương với B2. B2 là cao lắm nha. B2 là cao lắm luôn á. Dạ, B2 khó. Nếu mà IELTS là phải nếu mà B2 phải 6,5 ha. Nên cao lắm đúng không? Cao, B2 là cao. Thì nói chung là đến câu học mình cũng chưa biết luôn. để mình sẽ hỏi lại và sẽ thông báo trong thời gian sớm nhất. Bằng đó đúng là bằng FCE thì không có thời hạn thiệt. Đúng là bằng FCE là không có thời hạn. Dạ, đúng là nó không có thời hạn á. Dạ, thành ra đúng là nếu mà mình cảm thấy lo là hết hạn này kia thì đúng là mình nên thi FCE. Nhưng mà không biết nay người ta có tổ chức FCE không á? Ít giờ thấy toàn là IELTS với TOEIC. Có hả? Vẫn có tổ chức FCE. Thực ra bằng FCE rất là tốt nha, mình cũng thấy rất là hay. Vẫn tổ chức that's good. Thì nếu vậy thì cái đó rất là tốt. Đúng là cái đó không có thời hạn. Dạ đúng luôn. Dạ. Thì trong này chắc nhiều là cao học ha. Dạ, thì chắc là phải hỏi sớm chứ không là mất công mình học mệt mà cuối cùng là bảo là không thi như vậy đó thì mất công ha. Dạ, thì để mình sẽ hỏi nha. Dạ, mình sẽ hỏi sớm. Okay, thank you very much. Yeah, thank you. See you next week. Thank you.
Dạ cô, vậy nếu có thông tin sớm nhờ cô nhắn vào cái group Zalo của nhóm á cô.
Dạ.
Tụi em cảm ơn.
Để xíu mình hỏi lại thử ha. Để mình hỏi lại mà có tin gì thì mình nhắn lên đó liền nha. Dạ, ok.
Dạ vâng, em cảm ơn ạ.
Dạ, thank you very much. Yeah, goodbye. See you next week. Thank you.